to
Dr.
be.
Dure, you may start
Yeah.
now.
Okay, sure. So, hello guys. I'm Dr. Dure and I'm a mentor from Mid Institutors. So, I'll be talking regarding the whole PLAB pathway, how you can, plan your journey, what will be the cost of the individual exam, and what are the best resources to ace exam, and what is the timeline. Okay, so let's start with introduction. What are the learning objectives? So first of all, route to PLAB pathway. You need to take OET, PLAB 1 and PLAB 2, but do not worry as we're going to discuss each part in detail shortly. Before we start discussing regarding the PLAB pathway, I would want you to know who are we. So we are from Med Institutors. Med Institutors is a trusted e-learning platform which is empowering doctors, not only doctors from Pakistan, but globally. So at Med Institutors, we go beyond conventional study materials, and our platform is your one-stop destination for personalized assistance and insights tailored to your exam journey. That's not only limited for PLAB, but we also deal with MRCOG, MRCEM, MRCPCH, or other postgraduate exam. And Med Institutors is committed to empowering you with the knowledge and the skills that you really need for the success. So there's some exciting news as well for you guys is that we're on the brink of introducing mock exams also for PLAB 2. And this is going to be an amazing feature for all of you guys who are really wanting to ace their exams in the first go. So now starting with PLAB, what is PLAB? PLAB is the Professional and Linguistic Assessment Board test, or the PLAB test helps us to make sure doctors who qualified abroad have the right knowledge and skills to practice medicine in the UK. So it's actually a gateway to practice medicine in the UK, or you can say a gateway to your GMC registration. So there are certain steps and there are some prerequisites of this exam, and we will discuss everything in detail. So PLAB actually comprises of two parts. So there's one theoretical part, part 1, which is a written multiple choice exam with 180 single best answer questions, or you also call them multiple choice questions. And then part 2 is a practical, objective structured clinical exam known as OSCE, and you'll need to pass both parts before you can apply for registration with a license to practice medicine in the UK. So part 1 is a theoretical exam, and part 2 is a clinical and objective structured clinical based exam, which is an OSCE. And part 2 can only be taken in the UK, Manchester, and it's not, you cannot take anywhere else in the world. It's just done in the Manchester. So, and there are two centers for taking this exam, Hardman Square and Hardman Street. As you know, the PLAB is becoming a very popular exam for doctors who want to pursue their career in the UK due to many good reasons, of course. But there's, of course, there's a lot of confusion and uncertainty as well, on there's a confusion on where to start, how to start, what are the best resources. And there's so many videos and so many resources, but we're literally very confused on, what's the right pathway and what's the right thing that we need to begin with. So I have compiled things for those in need and who want to prepare for PLAB 1 in 3 months or maybe 5 months. That's totally up to them. And also PLAB 2 in 2 months. So I've written PLAB 1 in 3 months because this is the minimal time that you need to, because whenever you're planning for any exam, whether it's PLAB 1, PLAB 2, or it's MRCEM or any other exam, you need to be a bit more realistic in the preparation. So this is the least minimum time that one should give, that is 3 months. And PLAB 2 can be done in 4 to 6 weeks or 4 to 8 weeks. That literally depends on person to person. So now coming to how you can plan your PLAB journey. So first of all, it starts with getting a medical degree, finishing primary medical qualification, and you can start your PLAB journey while you're still a medical student. But you need to finish the whole MBBS, and then only you can start your PLAB pathway. But no one has stopped you in going through the question banks throughout your MBBS. You can do that, but you can take this exam only after MBBS. After MBBS, you're going to complete your internship. It makes you eligible for full GMC registration. And in the long run, it gets troublesome for IMGs to get into, foundation training. So it's always better and recommended to complete your internship, because without internship, you're going to, get into FI1, that is the house job. If you've done your house job in your hometown, it makes you eligible to enter into FI2 training, foundation year 2. Now, after this, so the prerequisite, I was talking regarding the prerequisite of PLAB 1. So what are the prerequisites of PLAB 1? So first of all, you have to make account in the General Medical Council. That's a board that registers doctor who wants to practice medicine in the UK. So you have to make your account, and you will give all your details regarding your medical degree, your internship, and everything, your personal details, your national ID. You're going to give all those details, and then you will make an account. You will be assigned a GMC registration number. And with that GMC registration number, you're also going to book OET. So before PLAB 1, to get eligible to take PLAB 1, you need to pass IELTS or OET. So that's totally optional. That's up to you whether you want to go for IELTS or you want to go for OET. And the required score for IELTS is 7.5, and I'll discuss this as well in detail. After that, after taking PLAB 1, and if you've passed PLAB 1, I generally recommend do not rush into things. Do not rush in, okay, getting the EPIC verification done. Just wait for your results. When you're past PLAB 1, go for EPIC verification, and which will verify your medical degree. And it's like a two-step process. They'll first of all do an interview with you from California. This is ECFMG certification, and they're going to ask you for certain dollars, which is almost like 50,000 rupees in Pakistani. Around $250 it takes to for the whole EPIC verification. After this, then you can, because if you pass your PLAB 1, then you can, plan your PLAB 2. But before that, you need to, apply for the visit visa. That's also, again, another chapter, a full length topic regarding how you can plan your visit visa, what are the requirements, and what documents you need. And we can, plan another session for that. So after that, when you planned your visit visa, you've booked your PLAB 2 exam, and then you have to sit for your PLAB 2. And if you've passed your PLAB 2, then you'll apply for GMC registration. And after you have done with your GMC registration, you will apply for the job in the NHS, which is National Health Services. Any questions so far? Okay.
We have questions in our chat box.
Okay. Okay, so you guys have questions in the end. That's fine. That's totally okay. So OET and IELTS. First, so the first step is OET and IELTS, as I've mentioned. Okay, so that's totally a personal choice. If you think that your English language skills are exceptional and you're very confident in your English language, then you can go for IELTS. Specifically, I would say if you're very confident in the essay writing area. So then, because the most challenging part of IELTS is neither reading, neither listening, neither speaking. It's actually the writing part, where most of the students, they struggle passing the writing of IELTS. It's not that expensive, but literally I've seen so many candidates giving IELTS 6 times, 7 times, 8 times. So it's better to give OET, pay a bit extra, but it's a better exam. And honestly, you guys can clear this exam in one go with the right guidance, of course. So whether it's IELTS or OET, it's mandatory to give one of these exams to prove that you have a good hold on your English language skills. So pick one and start preparing it at once if you're planning to give PLAB, that we've discussed already. So what is OET? So I'm going to talk about more about OET because I'm a bit OET pro here. The reasons I'll give you, because first of all, when you're talking about OET and IELTS, IELTS is totally an English language thing. So even when you're preparing for IELTS, you won't be that much interested in the whole preparation process because it's not really related to you. Because it's totally an English language thing, right? But when you're preparing for OET, the best part that I loved about OET is when you're preparing for reading or you're preparing for listening or writing or whatever, it's not only your preparation for an English language test, but you're actually going through a lot of research materials. You're going through a lot of topics, a lot of diseases, and it actually solidify your concepts, which is related to your medical field. So I really recommend people to go and to choose OET over IELTS. That's my personal choice. You guys can follow whatever you want. So the occupational English test, OET, is an English language test that assesses the English language proficiency of overseas trained healthcare professionals seeking to register and practice in an English speaking environment, which is probably the UK in our case. So what is the minimum requirement? You must achieve a score of 7.0 in all sections or 7.5 overall if you sit the IELTS, or grade B, which is 350 score in all areas if you sit the OET. So the catch point here is the GMC requirements. According to the GMC requirement, you need to pass reading, writing, listening, and speaking in one go. So there's no choice, like if you, because in people usually choose IELTS because they think that okay, even if they failed writing, we can reattempt writing only. So according to the GMC new guidelines, you have to pass all the modules in one go. So there are 4 parts, either it's IELTS or OET. Uh, 4 parts: reading, writing, listening, and speaking. And you need to score 350 in each module, which is grade B, or 7.5 overall, or 7.0 in each. Okay. So when it comes to preparation, if someone has taken IELTS before, it becomes a little bit easier for them, as two domains of OET are similar to that of IELTS. But I would recommend you to choose wisely whenever you're going for your exams, whether it's your preparation materials, whether it's your selection between IELTS and OET. Guys, please choose wisely. The difference comes in writing and speaking, as I've mentioned. It should take a month roughly if you're practicing daily and giving each domain a week. But it totally depends on your English language skills. I've seen people clearing this exam in 10 to 15 days as well. Personally, I took 20 days, but I studied a lot. So that's totally, like, it depends on person to person. However, you are comfortable, you can take this exam according to your timeline. So now we'll discuss PLAB 1 in detail. So PLAB 1, what are we going to discuss? As we mentioned already before, that what is PLAB 1? We'll discuss the exam structure of the PLAB 1. What are the best resources for PLAB 1 exam? This is the, I would say, this this will be the diamond thing for you guys in this lecture, because this is the most important thing whenever you're preparing for any exam. You need to know what are the best resources for a certain exam. Then after that, we're going to discuss how you can how you can find your PLAB 1 exam center, and what to bring on the day of the PLAB 1 exam, and how you can plan your preparations. So as I've already mentioned that it's in 180 single best answer questions, and is a computer marked written multiple choice uh, type exam, and you'll be given a short scenario followed by a question, what is the single most likely diagnosis? And they'll be given 5 options, okay, underneath, A, B, C, D, E, and you need to choose one single best answer. And there is no negative marking. So, okay, now we'll discuss this thing in detail because it's really important. What are the best resources? So, there are many resources: Plabbable, Med Revisions, Plab Keys, Plabverse, GMC Blueprint, and many other resources as well. But these are the top 5 resources that is used for Plab 1. So, guys, mark my words that Plabbable is considered as Bible for Plab 1. Like in USMLE, U word is considered Bible for USMLE. So, Plabbable is considered as Bible for Plab 1. So you need to, this is a question bank, and it has actually 2,500 to 3,000 questions. And you need to cover all this question bank, and it totally depends on your speed, on your timeline, and also on your schedule, how you're maintaining your day-to-day activities. So how you can plan your preparation wisely. It's recommended to actually finish one question bank, one read, in maximum 20 days, or you can finish it in 30 days. And once you've finished your Plabbable question bank, you can switch to mid revisions. I would recommend you to go through both of them. The reason why is Plabbable is a basic question bank, okay? So believe me or not, 60 to 70% questions will come from Plabbable, but they won't be exactly like the questions that are written in Plabbable, of course. They'll be a bit twisted. So you need to solidify your concepts. After your aced Plabbable, you've done your mocks and everything, and you're very confident that you know almost like 70 to 80% stuff you've crammed, and you know things from Plabbable. Now this is the time to upgrade your knowledge, upgrade your skills regarding understanding of a topic. You need to go through mid revisions, and mid revisions, believe me or not, it's enough, because there's so many links also given under each question regarding a topic, CK, or furthermore, if you feel that you're really confused in one topic, you can go through NHS guidelines, you can go through UK CKS guidelines as well. And it's recommended to go through the guidelines, of course. Always, whenever you're confused in one topic, always go through the guidelines. Okay, so then there is Plap keys. Okay, guys. So Plap keys is a bit overrated. The reason why people love going through Plap keys is because it's too much colored and highlights, and it's nicely written. But personally, I didn't went through Plap keys. The reason why I didn't went to Plap keys is because Plabbable and Plap keys is exactly the same. So it's better to go through one resource rather than going through 2 or 3 or 4 or 5 resources. So Plabbable will be your main resource. And after that, to upgrade your knowledge, you need to go through mid revisions. Okay, it's a bit difficult question bank. And after that, you will go through Plabverse. Okay, so I'll tell you how you can prepare for Plab 1, how you can start your preparation. So, like there are certain topics, table of contents. I'll share the syllabus with you guys as well. But like if you're going through cardiology, or if you're going through neurology, or whether it's gastroenterology, first of all, read it from Plabverse. Okay, guys. One thing I need to tell you that PLAB keys and PLABers is you do not need to buy it. Okay, so offline subscriptions are available. You can get offline PLAB keys and PLABers, but PLABable and mid revisions you need to buy these question banks. There's no other option. Okay, but PLAB keys and PLABers you do not need to buy. Everything is available offline. So first of all, you will, get the offline subscription of Labverse, and you will go through a topic. Like if you're going through cardiology, you will read cardiology, and then you will go on attempting MCQs for PLAB one. Sorry, PLABable, and then you can switch to med revisions. Okay. So, how you can plan your preparations? First of all, I would recommend you to have a study partner whenever you're planning your preparation because it's really motivating to study with your partners. Uh, Take them as accountability partners as well as your motivators as well, and it's easier. It doesn't look too much tiring. It doesn't feel too much tiring when you're studying with your partners, and it's highly recommended to join a WhatsApp group or any other platform like Telegram with active groups for PLAB 1 preparation. Make your own study plan, and whenever it comes to making your study plan, I always recommend to make practical plans. Do not make non-practical plans. Like, do not try to okay, I'll cover cardiology in one single day. No, you can't do that. So make practical study plans. As I mentioned, that first of all, you will go through theories. Either you can go through PLAB keys or PLAB verse, and then you will attempt your MCQs. While attempting MCQs, I highly recommend to note down the wrong questions, your wronged answers. Note down, make your short notes, okay? And the difficult questions or the question that are totally ununderstandable and you're not understanding the concept, flag them so that you can review them again and again. Okay, so also make sure while making your plan to finish a week earlier, as there are days where you're not able to complete your task, and sticking to 2 month plan is very important here. The third point, most important, and I highly recommend this, and this is what you can say extremely important part of your preparation is revision. You have to revise every single day, no matter what. Depending on your schedule, either take 15 minutes out, 10 minutes out, or 30 minutes. You have to revise the topics that you've studied before, 30 minutes in the morning and 30 minutes before bedtime. And if you do not have that much time, then you can revise those topics 15 minutes in the morning and 15 minutes before bedtime. Okay. So then the most important final thing comes after you've completed your question bank, flammable and mid revisions, you have to take mocks. Mocks, do not underestimate the mocks as they're preparing you for your real exam. So mocks are actually exam like paper. It's exactly the same, and you can literally simulate the whole scenario, how you'll be sitting. You can, take the GNC blueprint and start taking mocks. So it's actually said that you have to finish your flammable mock 30 minutes or 1 hour before, because you know all the questions, right? So you'll be able to finish 1 hour or 30 minutes before. But it's not really necessary. Do not worry if you're not achieving this speed. Uh, After 2 to 3 mocks, you will be able to achieve that speed as well. And your target score should be 80 to 90%. Okay, guys, as I've not only experienced success in this journey, I've also experienced failure. So I couldn't pass my PLAB 1 the first time. And I do not shy in telling this because it was a journey for me and it was an experience for me. And that's the reason why I'm giving you this experience. It's a really, I struggled a lot for preparing PLAB 1 because no one was there to guide me when I was preparing. Okay, so I was so much confused in different resources. I didn't had any idea how I can prepare, how to go about it, what is the best resource, how to plan it. And the first time, okay, so there is a myth, guys, regarding PLAB that it's an easy exam. Believe me, you will fail if you will consider it an easy exam. So do not consider this an easy or a cake piece exam. No exam is a cake piece. First and foremost, this is the thing that you need to learn. Okay. So because where I was studying or doing house job, people they're liars as well sometimes, and they told me that, oh, PLAB is not a difficult exam, it's an easy exam, you can do it. But as I didn't prepare, I didn't know anything about it, so I just prepared month for this exam and I couldn't pass. So please do not do this mistake. Give proper time so that you can prepare it in one go and you can pass it in one go. Okay. So table of content and syllabus. Uh, so emergency medicine, hematology, respiratory medicine, pediatrics, obs and gynae, toxicology, cardiology, pharmacology, endocrinology, ophthalmology, nephrology, ENT, and these are some other topics that will be that are actually assessed in PLAB 1. So 50% or you can say like 60 to 70% of topics are from medicine, right? And then it comes general surgery and peds and gynae and ops, all these topics are assessed. Okay, there is a very small chunk of epidemiology and genetics and all these psychiatry, and there's like very small chunk of these topics. Do not underestimate this small chunk because at the end you'll be struggling to pass the exam by 1 mark. Okay, so it's really sad when you fail by 1 mark only. Okay, so do not underestimate any of the topic and you have to ace each and every topic. Okay, so do not leave any topic on choice, I would say. Okay, like if you think that okay, genetics is not a very important topic, there'll be only 2 questions from genetics. No, it's not like that, because that's there is no certain quantity, though genetics will be smaller component, but you never know, they give 5 questions from genetics and you will be struggling at the end if you will leave that. So I would recommend, do not leave anything on choice, do everything. Okay, so this is a rough plan. The data entered here is totally a dummy data. Okay, so this just to give you an idea how you can plan your preparation. Like just count the pages of PLAB keys topics, or you can count the pages of PLAB verse as well. I personally use PLAB verse. So if there are 150 pages in respiratory, and then there are, count the number of MCQs as well, 150 MCQs in respiratory, then take at least 3 days to cover this. So try to make a target of completing 50 MCQs per day. Okay, so this should be your target, and accordingly you can plan the whole schedule according to your timeline. Now, finding your PLAB 1 exam center. How you can find your PLAB 1 exam center? You will be sent an email telling you where to go and what time you must be there. And try not to be late in any circumstances, because you won't be able to, I mean, no excuses for coming late. The exam will last 3 hours. Try to go, I would recommend try to go an hour or at least an hour, or you can go 2 hours before as well. And do not study a lot the last day of your exam, especially on your exam day. Do not go through the topics. Try to relax as much as you can on the exam day. You won't be allowed to leave the exam hall in the first and last half hour of the exam, so keep that in mind when you consider going to bathroom breaks into your exam time. So now, what are the things provided for the PLAB 1 exam? You will be given one A4 size booklet. I will show the front cover of that booklet as well with you guys. And this booklet has all the questions and also normal lab values at the end. So you do not need to worry regarding cramming the lab values. No. lab values will be given. But it's always better to, learn some important values so that you do not struggle finding for the normal lab values, because you have 1 minute for each question. So try to be wise in that. So each page contains 4 to 5 questions. So it's quite a thick booklet containing 180 questions. The questions have ECG and photos are on a separate paper tucked in with its corresponding question. Okay. So this was a very important point that you guys need to know, because sometimes people, and it happened to me as well in my real exam, that I forgot that there is a separate paper tucked in with its corresponding question. I forgot seeing that paper and I missed ECG findings, or there were some photos given and I missed those photos because I was unaware of this point. So you do not do this mistake, okay? Because now you know that there's ECGs and photos, they're on a separate paper tucked in with its corresponding question. So if you enter more than one answer on the answer sheet, you'll gain no mark for the question, okay? And there are also no negative marking, as I've mentioned before as well. So the responses come put down on a response. The exam paper also includes ECGs, X-rays, and different images like dermatology, rash images, or if there's any mole or melanoma, these images will be attached as well. You'll be given one double-sided answer sheet at the exam with instructions on how to complete it. You must complete the information required at the top of the sheet, and I will show you how it will look like. So what to bring with on the exam day of lab 1? So you really not to bring a lot of things with you. Also, I would recommend not to bring, the books and the notes with you. Even if you have short notes on the mobile, save that. That's fine, but do not, bring a lot of notes with you along, because it's just going to make panic, and panic is really bad for you. Either it's PLAB 1 or PLAB 2. So please make sure to bring your passport. And if you're taking your exam in your own country, you will bring your CNIC, National Insurance ID, and your booking confirmation. Try to make okay. So booking confirmation is very important. So try to make a hard copy of your booking confirmation. Along with that, that's totally optional, because generally you will be given HP pencils, eraser, and a pencil sharpener by them. But in sometimes in some centers they might not give you, but that's highly unlikely. But in case, just in case, keep these things with you. And do not bring your bag, phone, study materials. Do not bring anything valuable. Okay. So also there's a GMC blueprint. You can just have a read regarding that blueprint, and also you will be sent an email as well, and everything will be written on that email. What are the do's and don'ts? What are the requirements of the exam? And what to bring, what not to bring. The timings are also written on the email, the center, everything. Okay. So, guys, this is exactly the paper that you're going to get in your exam. Okay, it's exactly the same. So you will be writing your name in this name area. You will be writing your city in this area. You'll be writing the date, and write your GNC number clearly. There should be no mistake in writing your GNC number, otherwise your result will be affected. So everything is written. You can, go through the detail. Please use a pencil only on this answer sheet. This form will be scanned and electronically marked. So do not fold or crease this sheet. The answer sheet is double-sided, contain 200 or 180 single best answer questions. For each questions, you will be asked to choose one option from the list. There's 200 written, but it's actually 180. So give one answer to each question. Do not underline or do put a dot or do it like this. They'll give you an example. You have to do it, mark it like this. Okay. So The next topic will be your after you're done your PLAB 1, you passed your PLAB 1 in one go, then comes the big exam, PLAB 2. Believe me, it's a very tricky exam. There are there's so much into it. There are a lot of do's and don'ts. People consider it it's like it's a subjective exam, as you know, you're not really sure how they're marking you. But we will have another session on this as well, and it's like a vast topic. PLAB 2 is a whole, it's a very tiring and a rough journey, because a lot of finances are involved in PLAB 2. Plus, you're taking this exam out of your country, you have to travel, you have to properly plan, you have to apply your visit visa, and there's a lot to do in this. It's like a very heavy exam. Believe me, people think that PLAB 1 is easy. No, PLAB 2 is easy, PLAB 1 is a bit difficult, but I consider PLAB 2 is the most difficult exam. It is not, but if you do not know how to prepare, then it is. Okay. So PLAB 2, part 2 of the test is a practical assessment and takes the form of an objective structured clinical examination. So in this exam, they're not actually they're not only uh, checking you on your clinical knowledge and clinical skills. They're checking you on your personality as well. So interpersonal skills, there's like 4 marks for interpersonal skills, which includes how you're talking, how you're coming to your cubicle, how you're sitting in front of a patient, if you are moving your hands, everything is being marked, believe me. And a slight mistake you do, they're just going to struck you off. Because there's a lot of competition, believe me or not, but I consider, though it is not a competitive exam, but plus minus you say it is a competitive exam, because there is no set criteria. Even if you go in the General Medical Council GMC website, there is no set criteria for pass. There's no pass mark for each station. Every exam has different pass marks, so you're actually being marked against your peers. Okay, so there's relative marking in this. So if others are performing really well, and if you've done a slight mistake only, this that was not a big mistake, but that mistake will actually cost you your exam, cost you 1,000 pounds, the whole visit, full PLAB 2. So there's a lot to tell about this, but okay, let's just talk regarding the basics. As we can see that there are 3 domains. Your every OSCE station will be marked against these domains. Data gathering, there's 4 marks. Clinical management, 4 marks. Interpersonal skills, 4 marks. And following will be the skill set area that you will have to portray, like how you are beginning your consultation, how overall your consultation is. If you're giving a diagnosis to the patient, there's 1 mark of diagnosis as well, because if your diagnosis is incorrect, believe me or not, you're not going to pass that station. Even if you're giving a you're not going to give provisional diagnosis, of course, but even if you're given a, differential diagnosis and it's a right set of diagnosis, then you'll be marked for that station. But if you're making a blunder, you're giving a wrong diagnosis, then you're not going to get marks for that station. So there are 16 stations, okay, and there are 2 rest stations, and you have to pass 10 stations out of 16 stations. Before COVID-19, there were 18 stations, but now after COVID-19, there are only 16 stations, and the exam is of 3 hours. So, and it's actually 1,000 pounds. You have to pay 906 pounds to sit for this exam. Consultation, and you'll be marked against diagnosis. If you're giving an examination, proper investigations plan, what plan are you giving, what are your findings, what were the issues, concerns, Okay, so the most important part of PLAB 2 and your consultation will be if you're exploring the ideas of the patient, concerns of the patient, and expectations of the patient. So this is called icing the patients. If you're exploring all of this, then you're good to go. So ice is very, very important in each and every station. So I generally say that there's a triangle of three things that you need to do before you leave any cubicle. So there are three things that is a must. Number one is that you have to explore the psychosocial aspect of the patient, because in PLAB 2, they're not really bothered how much do you know about a disease. They're really bothered how much you're concerned regarding the patient. And if you explore the psychosocial element, because in the UK, they really give importance to the psychosocial aspect. So this is a must, must, must for PLAB to all of the stations. Psychosocial element, so effect of symptoms on their day-to-day activities, and then idea, concerns, and expectation. Icing the patient, and the last and most important thing, red flags, warning signs. So before you leave the cubicle, you have to safety net, like you have to discuss the warning signs with the patient regarding that particular disease. Okay. Then they'll be checking your language, if you're talking appropriately or not, if you're listening to the patient. Okay, so listening, how it will be assessed, like if the patient have told you one thing, if you've asked like an open-ended question to the patient, like, okay, can you tell me more about it? And if they've told you everything in one go, and you're again asking that question, you will be marked negatively for data gathering. You won't, you will be literally struggling that station, because it means that you're not listening to the patient. They've already told you one thing in one go, but as you were not listening, so you didn't know. So it's a lot of practice, guys. It's a lot of practice, and it comes with practice. Okay. Then you'll give a management plan, and then how you will build a rapport, and you need to finish the data gathering, and you need to give the management according along with, discussing the warning signs, risk factors. You need to give the general tips, make a follow-up plan with the patient, and also you're going to offer them leaflets or some reading materials within 7 minutes and 30 seconds. Okay, so there are 8 minutes for one cubicle, one station, but I would say that these 8 minutes, they are not 8 minutes, they're 7 minutes and 30 seconds, because 30 seconds you need to enter the station, you need to say hi to the examiner, hello to the patient, and you need to loudly tell your GMC number, your name in front of the examiner, and then you have to take a seat, sit, and then only you can start the station. So it literally takes 30 minutes to open the door, come in the cubicle, talk to the examiner, talk to the patient, and then start your station. Okay, so this will be exactly when you'll get your PLAB 2 result. This will be the PDF area that you're going to get. So station one, two, three, four, like station one is regarding erythema nodosum. Okay, so this is a dermatological condition. Okay, so consider if it's a video call consultation and you've not started your consultation, there's an approach for each station. If it's a video call consultation, there's a proper approach for how you can talk to a patient on a video call. If there's a telephonic consultation, there's a proper approach how you can talk to a patient on the telephone. If there is another consultation, whether it is like maybe face-to-face consultation, then there's a proper approach for that as well. So if you are not following that approach, you are going to get tick in consultation. Or if you're, if you're not structured and you're just going here and there, you will get a tick in consultation. And then listening, as I've mentioned, okay, so getting tick is not a good thing, believe me. So as many ticks as you have, it's a bad thing. Getting a tick is a bad thing. It means that you have, this is your problem area. So if there's no tick in diagnosis, examination, findings, issues, language, it means that everything is fine here, but your problem was your consultation. So this is, believe me or not, this is a very good the result strategy that they're going to give you. Not only they're going to give you marks against each station, but they're also going to discuss the problem area. So if you, just be open-minded. Even if you failed your exam in first attempt, do not feel like, oh, probably they're just strictly marking. It's a luck-based exam. Do not think like that. Focus on your mistakes, see where you were wrong, and try to improve those mistakes. Like if you've got a tick on consultation, try to learn all the approaches towards each station. Try to improve your mistakes, and try to first of all take a guidance in a way that you do not need to resit your exam, right? That's the best strategy to go about it. So as domains, I've already discussed that you will get 4 marks are given for data gathering, 4 marks for your management, 4 marks for your IPS. So data gathering, you'll be assessed against history taken, physical examination, practical procedures, or investigations leading to a diagnosis. In the clinical management skills, how you are formulating a diagnosis. This is very important. Like you cannot just give a diagnosis that way, okay? You need to sometimes justify your diagnosis as well. Like you can say, as Mr. Smith, as you've mentioned that in the history that you had cup and plus you're smoking for a long period of time and you're passing blood as well in the sputum. So it seems that you're having a condition that is known as lung cancer. So just pause, okay? And then they're going to give you, I mean, uh, their response. So this is a way how you can formulate a diagnosis. I will discuss everything in detail in the later sessions, but okay. So, explaining something to the patient, formulating a management plan. This is extremely important. And then interpersonal skills. How you approach the station, whether you establish a rapport with the patient, how you use opens, questions and close-ended questions, how you're involving the patient. Believe me or not, involving the patient is extremely important because they're not looking for candidates who have crammed everything and they're doing a verbal diarrhea. Okay, so you need to involve the patient, make the patient connected throughout the consultation. You have to look into the eyes of the patient and they have to connect with you. This should be there. Okay, you have to have that energy, you have to have that passion in you so that the patient can connect with you. Okay, and then you have to demonstrate how professional you are, and you have to also understand the ethical principles also, because only if you will understand the basic ethical principle, because see, most of the Asians, we are not following those ethical principles, we are not dealing that way with the patient. That's why we struggle passing our exams. So it's, believe me or not, a very different exam from your basic exams or from any other exam that you're taking in your home country. So also there is clinical evaluation. This is all taken from the GMC website. So they'll be checking your, you will be assessed how you are checking how you're checking the patient's blood pressure, how you are performing the venipuncture, how you're inserting a cannula into a peripheral vein. So calculating the drug dosage, because there will be some pediatric scenarios where you have to calculate the drug dosage, so you'll be assessed against that as well. How you're giving IV injections. Okay, so this is something really serious that they're actually checking how you're giving IV injections in the cement. So there's one station of emergency treatment and they're going to assess all of these things, like how you're putting the cuff, if you're measuring the blood pressure in a right way or not, if you're checking the doses in a right way or not, mixing and injecting drugs into an IV bag. This is also going to be assessed. Giving intramuscular and subcutaneous injections, this can come as teaching stations as well. Then basic cardiopulmonary resuscitation, suturing, interpreting ECG, X-rays, results of other investigations, interpreting basic respiratory function tests, the lung function test. Like you can get another station, like a full-fledged station on spirometry, on piclometer, and then you have to perform urinary catheterization, taking a cervical smear. There will be another station, and how you can safely dispose the sharps. If you've, even believe me, if you've done everything right and you've missed the safety disposal of the sharps, you'll not pass the station. Okay, so interpersonal skills involves explaining a diagnosis to the patient, investigation, treatment involving the patient in the decision making, communicating with the relatives, communicating with healthcare professionals, and also it involves checking how you can communicate with your colleagues in the hospital, how you can communicate with your nurse colleague, how you will communicate with your consultants, how you will communicate with the doctors in the hospital environment. So they're going to assess you in each and every domain, believe me. And how you will break, there will be one scenario, but no, that's not a must. It's totally up to them how they design the paper. Okay. So breaking bad news, how you will break the bad news to the patient, providing clear, legible written instructions where appropriate, like if there is a prescription scenario, seeking informed consent, clarification for an invasive procedure, obtaining consent for a postmortem, dealing with anxious patients, giving instructions on discharge from hospital, giving advice on lifestyle, health, promotion, risk factors, and other things also. Tell the examiner what you're doing and why you're doing this if you're in an anatomical model station. Okay. So before I end this PLAB2 thing, I just want to give a quick recap of how this exam works. So you will be having 18 scenarios, okay, 16 stations actual, 2 rest stations. So I want to tell you uh, where to focus and how to, prepare. So see, 5 stations are going to come. Number one is cement. It's a must station in each and every exam. It is going to come. One station will be prescription writing. One station plus minus, it sometimes comes, sometimes not. That's a teaching station. 2 or 3 stations will be combined stations, like you will be doing examination, taking the history, and also telling the management as well. So it's a bit extremely challenging scenario because you're doing your data gathering as well, you're doing your examination as well, and at the end, you have to tell the diagnosis, you have to explain your diagnosis, you have to give the whole management plan to the patient. Okay. So these 5 stations, it's easy to pass these stations, okay, because there are not a lot of stations regarding all these stations. So it's easy to pass. So how to prepare and how to pass PLAB2 is get a very good hold of this station. Prepare it extremely very well. And in this way, you can, lock your 5 stations, okay? Then 60 to 70, like 8 to 9 stations are from counseling and ethics. That's a bigger chunk, okay? So 8 to 9 stations are coming from counseling and ethics. So you need to focus more on how you're counseling a patient and ethical principles. And then like 2 or 3 questions will come from medicine. Okay, and then one from peds, one station will come from obs and gynae, one station will come from surgery, and then one station will be from derma, ENTI, and then there's like, okay, peds, gynae, and surgery, and there's psychiatry. One station will come from psychiatry. So this makes the whole like 16 cases. So there's no set pattern. Anything can come from anywhere. Sometimes they might give you 3 cases from peds. Sometimes they might give you 6 cases from medicine, and only 2 or 3 cases from counseling or ethics. That totally depends on the examiner and the person who is making the exam paper. Okay, so there's no set pattern, but the 5 stations like Simen, they're going to assess prescription, they're going to assess combined station, they're going to assess. So these 4, make sure that you prepare extremely very well and you pass all these stations. If you've locked all these stations, then passing the rest will not that be difficult, and you'll end up passing the PLAB 2 in first go. Okay, so guys, when you've passed your PLAB 2, you've aced your stations, passed your exam, take a relief and enjoy, go out and enjoy your free time, and then you will apply for GMC registration. So now, for applying GMC registration, there's one thing that's probably missing here, is that you need to have your valid OET or IELTS. So you need to pass your PLAB 2 within 3 years of passing your PLAB 1, and your OET or IELTS is, I think, valid for 3 years now. So if you have applied your GMC registration within 3 months of passing PLAB 2, uh, you can your OET will be valid for 3 years, and you can go on with GMC registration. But if your OET or IELTS is more than 3 years old, then you need to retake your OET. And so you need to have your primary medical qualification, you have to have your good standing certificate, you have to have your epic verification and your experience certificates and your other personal details, and then you will apply for GMC registration and you will come on the register, and after that you will start applying for the jobs. Okay guys, that was it till now. So you're open for any questions, if there are any questions.
I wanted to ask, what do you mean by good character certificate?
Good standing certificate. So actually, the good standing certificate is a certificate that is issued by which country you are from?
Pakistan.
Okay. So Pakistan, a good standing certificate will be given by PMDC. So like you've cleared your qualification, you've done your MBBS, you've done your house job, and you have your PMDC registration, right? Because nowadays you guys have to go for NLE exam as well to get your registration, right?
Okay. What
So
if you only had like the provisional license?
even if you have provisional license, I think PMDC will be able to give you good standing certificate. But you need to you need to contact PMDC. What's the requirement of giving the good standing certificate? But the basic requirement is that you need to have your license to practice in Pakistan, and they're going to give you good standing against that license. And that's, I think you need to pay 5,000 rupees, and you book your good standing online, and you will receive your good standing online as well. You do not need to visit Islamabad and visit the PMDC office.
Okay. And one more thing, by experience certificate, do you mean like the house job one?
Yeah. House job certificates. And make sure also there is a certain criteria for your house job. You should not have a lot of, not a lot, in fact, you should not have any gap between the house job period. Because otherwise the GMC will question you that why you had this gap, and your registration process can be affected. So try to complete your house job in one go. Try not to have any gap between, like 6 months, 3 months your medicine, 3 months your surgery, and 3 months allied medicine, allied surgery. This is the pattern accepted for house job. Any other questions? So, guys, please do give me the feedback as well regarding the session. How was the session?
Ma'am, we have questions in the chat box.
Okay. I was just about to open the chat box. You can book PLAB 1 without passport. You will present your CNIC when sitting in the exam when you are giving it in your own country, but you absolutely need it for PLAB 2. I made my GMC account based on my CNIC only. Okay. Okay, that does not seems like a question. Okay. Screen is visible. Hello, I have started a few hours a day. For now, I'm doing PLAB keys. Shall I switch to mid revisions next month? Okay, so it really depends on how much hold you have your plabbable. I would recommend you to only switch to med revisions once you have a very good hold of plabbable. Try to make a very good hold of plabbable first, and then only switch to med revisions. I know people have passed PLAB 1 just by plabbable as well. So do not worry about that. But just to be on a safe side, it's always better to switch to med revisions as well. How to prepare for PLAB 1 from first year MBBS, which subjects are most important. So I won't recommend you to start preparation from your first year MBBS. Instead, if you want to, prepare for something that's USMLE, you can start from first year MBBS from your foundation years. But PLAB is actually generally more clinical based. It's not, theoretical. So I recommend preparing for PLAB 1 from your fourth year and final year only. And you can, start doing your multiple choice questions, your question bank. When to start preparation for May attempt? Okay, so for May you'll be having 3 or 4 questions. Months. So it totally depends on person to person. 3 months, I would say, please give at least 3 months for your preparation. If you think that your preparation is not that sufficient and you're not getting good marks in mocks, so you will judge yourself by mocks. If you're not getting good marks in mocks, then you can um, literally extend your preparation time. Guys, for PLAB, OET is best option or IELTS? What experience do you suggest? As I mentioned in the session as well, that I'll only suggest OET because OET is the best. Just give OET in one go, and actually, it's really interesting exam as well. I'm just going through the questions. So, when will GMC release seats for PLAB 1 in 2024? So you can either email GMC on their official website, and they'll be able to give you the correct answer, because I do not want to give a wrong answer to that question. Can I book for PLAB 1 without passport? Well, that also, it's better to ask GMC, and I think yes, you can book your PLAB 1 with your CNIC as well. Can somebody give PLAB 1 during PG residency first year? Should I drop PLAB pathway? Pakistani people, please help. Oh, why not? I mean, you can definitely give PLAB 1 during your PG residency. It totally depends how you're going to manage. Can we book PLAB 1 without having passport? Okay, that's already answered. Could you please elaborate on the effect of career gap for having GMC registration, getting a job in UK? I will come to UK with my husband as he got a job offer, so I have to resign and come. I haven't booked PLAB as well, so it will take some time to complete my PLAB exams. Okay, so the good news for you guys is career gap really does not matter. I know so many of my colleagues who had like 5 years, 10 years, 15 years of career gap, and they're still working in the NHS. So it really does not matter. So it's just, and even scores does not really matters in PLAB exam. You just need to pass the exams. but you need to prepare very well to pass the exams, without a doubt. Can you please tell me how to study PLAB keys? What are PLAB keys? So PLAB keys is actually, it's just like Plabbable. Either you study Plabbable or PLAB keys. It's just the same. I do not recommend going through PLAB keys, honestly, because it's just probably wasting time going through so many resources. It's just overrated. Go through Plabbable and go through it nicely. Okay. And if you want to add on a resource, or you want to upgrade your knowledge and you want to be a bit more knowledgeable, and you want to ace the all tricky question, 10 to 20% tricky question as well, then you can go for mid revisions. But PLAB keys, I do not really suggest going for that. But it's good. It depends on person to person. If you are very much comfortable with PLAB keys, you like it, then you can totally go for it. Ma'am, please, I'm from Ghana. I booked PLAB for Feb. My visa might be delayed. I want to cancel and book for a later date. How can I go about it? Booked PLAB for my Feb. Okay, so did you book for PLAB 1 or PLAB 2? Because if it's PLAB 1, then you do not need to travel. You can take it in your home country probably. If you're traveling, then I think then you might need to rebook. It totally depends on your preparation. If you think that you're really well prepared, then go for it. Otherwise, just do not go for it. Okay, take care. Thank you so much. Okay, so Minhal, whoever is on the back end team, I think we're done.
Yes, ma'am. All questions are answered.
Okay, so see you next time. Take care.
Thank you so much for the wonderful session, and it was a pleasure having you today.
Okay, thank you so much.